PA is a 78-year-old Caucasian female with burning urination, chills, fatigue, and poor appetite that started yesterday afternoon. Her pain is 3 out of 10 when she urinates. She has urgency, frequency, nocturia, and hematuria. Tylenol barely gave her any relief. Her blood sugar prior to coming to the clinic this morning was in the 200s, when it's usually in the 100s. She has hypertension, diabetes, and arthritis. She did not take any of her blood pressure medications this morning, and she doesn't take anything for diabetes either. Her vital signs are 100.2 Fahrenheit orally, heart rate is 122, blood pressure is 178/90, and she mentioned feeling confused this morning, but when I did my neuro exam on her, it was intact. No CVA or suprapubic tenderness also. To narrow the differential, her primary diagnosis is a complicated urinary tract infection. She also has diabetes and hypertension as comorbidities. She has a complicated UTI, and this is supported by her dysuria, urgency and frequency, hematuria, low-grade temperature, and tachycardia. Her negatives are no CVA or suprapubic tenderness, no history of urinary disorders, no urinalysis is also available, and she did not report any odor. For hypertension, her blood pressure was elevated this morning. She did miss doses, and she is in acute illness. This was also just a single reading. For diabetes, she reported her blood sugar was over 200 this morning when she checked, but she's not taking any medications. And we also don't have an A1C, and we also don't have a point of care glucose. For my preceptor, since she was already tachycardic and had a low-grade fever, should blood cultures be collected? If her blood glucose is elevated, should we treat it or wait till labs come back? My plan for her is to order a CBC, a CMP, urinalysis with culture, hemoglobin A1C, and a point of care glucose if we can do so. I'd like to start her on ciprofloxacin 500 milligrams orally twice a day for 7 days and continue her antihypertensive medication. I also maybe consider initiating metformin after labs are seen. Also, I would manage her dehydration, her blood pressure, and glucose monitoring. I plan to review how to manage hypertension and diabetes during acute infection, and I would also like to deep dive into management of complicated UTIs in older adults with multiple comorbidities. Thank you.